Thank you for tuning in to today's episode of Medical Device Global Market Access by Pure Global. Today, we're exploring a transformative trend at the intersection of materials science, personalized medicine, and digital health: 3D-printed bioactive implants. We will focus on a groundbreaking example, the TrabeculeX technology from Xenco Medical, to illustrate the power of this convergence. For decades, spinal fusion surgery often required a secondary procedure to harvest bone from the patient's own body, typically the hip. This autograft procedure adds time to the surgery, increases blood loss, and can lead to significant postoperative pain. The industry has been seeking a better solution, and advanced biomaterials are providing the answer. In January 2024, Xenco Medical, a company recognized by Fast Company in its 2023 list of the world's most innovative companies, unveiled a system that addresses these challenges head-on. Their platform combines a specialized 3D-printed spinal implant with a patient-centric mobile application. The implant itself, known as the TrabeculeX Bioactive Matrix, is what makes the difference in the operating room. It's an intricately designed scaffold made with a bioactive glass material. This material promotes the body's natural bone growth, creating a robust fusion without the need for an autograft. This innovation is reported to cut surgical time by an average of 35 minutes, a significant gain in efficiency and patient safety. But the innovation doesn't stop when the surgery ends. The system is paired with the TrabeculeX Recovery app, extending care from the hospital to the patient's home. Surgeons can enroll their patients in the app to prescribe and remotely monitor patient-specific physical rehabilitation plans. The platform allows for tracking posture and progress while enabling communication through asynchronous video and text messaging. This creates a powerful feedback loop between patient and provider, ensuring a more guided and engaged recovery process. The market adoption and patient response have been notable. This technology is already being used in over 50 hospitals across the United States. Furthermore, patient engagement data shows impressive adoption, with users averaging 11 minutes of daily interaction with the recovery app during their first 90 days post-surgery. This combination of a more efficient surgical implant and a digitally connected long-term recovery tool represents a new paradigm in patient care, bridging the gap between the surgical event and full rehabilitation. If your company is developing cutting-edge technologies like this and needs help navigating the complexities of global market access, please reach out to Pure Global. Thank you for listening, and we'll see you next time.